This is the midday view on eNCA. It's good to have you with us. Well, the fight against COVID-19 continues. Healthcare workers who received J&J jabs in the first half of this year are now eligible for booster shots. This is part of the Sisonke clinical trial to test the efficacy of the vaccine. eNCA's Manqoba Mchunu is out at Chris Hani Baragwanath Hospital and joins us now with an update. So, Manqoba, you've been speaking to some healthcare workers there and also observing this process to give them the second jab of the J&J vaccine. What is the mood? What is the sentiment among some of the healthcare workers that you've spoken to?
Well, to us, there's certainly a sense of relief from some of the healthcare workers that we've spoken to. Of course, these were some of the healthcare workers that were part of the first phase of the Sisonke study who would have received one dose of the Johnson & Johnson vaccine. Of course, they have been fully immunized, but you recall that just recently the country also giving the green light for those J&J booster shots to be given to healthcare workers ahead of the fourth wave of infections. And of course, the issue that is of course at play here is the issue of the waning of the immunity of these particular vaccines, with some of the studies showing that perhaps there is a need for a booster shot to be given to healthcare workers, but not only healthcare workers, but also to other vulnerable groups in society. But at this particular point, this phase of the study, which is the second phase, is particularly targeting healthcare workers who were part of that study. There are about 496,000 of them that were part of that initial study. And so far, we do understand that the department has sent out SMSs to over 391,000 of those healthcare workers to come and receive this booster jab. And certainly, earlier on, speaking to some of them, one of the doctors here at this particular hospital saying that she herself had COVID-19, and so receiving this booster shot was really something that she finds as a relief, given that she also works with patients here and she also has to deal with some of those who are infected with COVID-19. I spoke to two of the doctors earlier on. This is what they had to say to us.
I'm excited. Firstly, when we got our SMSs this morning, we said we're coming straight through. We want the second dose with a 9 times more efficient protection against COVID. How can we not have the second dose? So I'm very relieved and I'm very excited and I'm happy to have gotten this jab so quickly.
I was very excited because with COVID it has been a very difficult period, seeing relatives pass on, seeing friends pass on. This is very important for us to all get the vaccination, especially to support the healthcare workers who are more exposed, and also just to keep the family intact, as COVID really does affect a lot of things in our lives and we need to get back to normal. So I would encourage everyone to get vaccinated because this is our lifeline. Because with COVID, besides vaccination, really there is no hope for us. Let's all vaccinate.
Right, so Manqoba, I see that it's quiet where you are right now at that vaccination site at the moment, and one presumes that perhaps it could be lunchtime because I don't see any activity. While you describe that scene, talk to us about the other leg of the story that has to do with some skepticism among some of the healthcare workers.
Well, certainly to us it is tea time here, in fact lunchtime here at the Chris Baragwanath vaccination site. In fact, just a few moments ago this centre was closed so that the healthcare workers who are working here, who have of course been working since this morning, can get time to go off and get some lunch for themselves, and then it will of course it is expected to continue after 2 o'clock. We have seen, to us, quite a number of healthcare workers coming here this morning, doctors, nurses, nurses who really wanted to be part of this particular second phase of the vaccine. They, of course, received SMSs, have given consent to the department to go ahead with this particular vaccine. But, of course, there has been some skepticism on the part of some of the unions. One of those unions is a Young Nurses Indaba trade union, which raised some concerns about this second phase of the booster shot, questioning really the efficacy of the J&J vaccine and saying that, you know, if at all we're told that this particular vaccine requires a single dose, why then now are we seeing another booster shot being given to healthcare workers, of course, saying that they are being used as guinea pigs. And these are the sentiments that we've heard, of course, from that particular union when this phase of vaccination started in February. Back in February, when the first phase, in fact, started in February, they also had issues when it comes to that, saying that nurses and doctors should not be used as part of the study, but that they should be given vaccines that are going to be able to deal and fight infections in terms of COVID-19. So that's the skepticism so far. But of course, government saying that nobody will be forced to take this vaccine. It's not mandatory. And of course, those healthcare workers will still have an option to take it or not to take it.
All right, eNCA's Manqoba Mchunu out at Chris Hani Baragwanath Hospital. They're monitoring one of those vaccination sites. There's always that debate, those various views around the issue of vaccinations. We were scheduled to speak to Professor Shabir Mahdi. Unfortunately, this seems to be my hand today, the hand that I keep getting. He's also had to cancel on us, and I'm pretty sure that, we'll be able to rearrange a different time that is convenient and that works for all of us.